You got a lot going on in the world. You know, I really like this business. I like the industry. I spent time in the business. I think a lot about it. I think it's a good face for the company. It's important that we do it well. I think what you see today is a little bit from where I sit, a need to kind of rejuvenate our own business. You know, a way to kind of in some ways reset, reboot, if you will, what it means to be GE Healthcare in the environment where we've had to play a lot of defense over the last 5 years. I mean, we've had Deficit Reduction Act, FDA invasions. You know, I could just go down the list. Stimulus, reform, all those things going on, and you know, kind of with our own team and with our customers. You know, what does it mean to be GE Healthcare? What is our vision going to be in a different world? And not believing that it's going to go back to where it was in 1997 or 1999, but you know, what can it be? So that's really where we came up with you know, the notion of health imagination, which really has to do with really more R&D spending, but a focus on R&D in different places. You know, some of the same places, but some different places. More products, more price points, more information technology, more services, more solutions. You know, a whole series of things like that. A focus on our own employee base. So for the first time in more than 20 years, we're going to change the GE Healthcare plan. And it's going to be a pretty comprehensive and pretty focused change in our own employee healthcare plan. You know, ability to engage with our customers and with governments in terms of where healthcare policy is going to go. And so we're trying to, you know, fly those under one big banner called Health Imagination, and you know, try to change and reset what we want to do in the future in healthcare. But you know, this is a core GE business. It's a lot. You know, we probably spend close to $3 billion on employee healthcare costs, so we're embedded in this industry. It's like a marathon. You know, when I was 25 years old, 26 years old, I decided I wanted to run a marathon once in my life. You know, so I lost weight, trained, stuff like that. And I ran a marathon in about 4 hours, Washington, D.C., and I really almost died. I tripped across the finish line. That's what Obama's going to feel like when he finishes this health care bill. It's going to be like finishing a 4-hour marathon, being slightly overweight, you know, just, and then I think the question is what happens post-reform. You know, in other words, the way I kind of think about the company is not so much the reform is going to be fragmented. It's not going to be big. It's going to impact us in some places. It might help us in others. But I think about what happens after reform, and this is not meant to be self-serving. I really think it gets back to the companies. I really actually think that where healthcare reform is going to have to take place is going to be about the companies, because in the end we have the most skin in the game. And in the end, you know, we're going to have to change the way our employees buy healthcare. And I don't know if, you know, how many of you are in GE towns. We have to change the way our providers work with us. You know, it's just, and I try to explain this to really the president, but the other people to say, you know, guys, look, we're a big employer in Louisville, Kentucky, right? Louisville has 15% unemployment. Our health care passed along to us this year was up 15%. By our local providers, because they say, look, our Medicare cuts go down, you have to pay more. So that's the healthcare system, right? You take one thing away, it's not like the cost actually comes out of the system. It gets pushed around, and so, you know, we care deeply about how that all takes place. So I really do think employers are going to have to get together. I can very much envision the 25 biggest employer payors in the country getting together sometime next year and really pooling and deciding what they want their health care to look like, converging on certain health care plans across 25 big companies in the U.S., and coming to all of you and saying, we're all self-insured. You know, we all have these big legacy costs that we have to manage. We all have a certain number of people that have diabetes and other chronic disease. We all spend 65% of our health care spend on chronic disease. And I can see something like that maybe happening in the next year, post-reform, in order to find ways to control our own healthcare costs.